Hey, it's Dr. Bill with just the tip of urology school. This segment, we address renal cysts. Renal cysts, basically a bag of fluid in the kidney, and actually quite often found as an incidental finding on ultrasounds or CT scans for other reasons. The trick is to understand that most of them are simple versus complex cysts. And we know that simple cysts do not cause a problem. And in fact, some radiologic associations don't believe that simple cysts need to be followed. The incidence of cysts increases with age to about 30 to 50% of us over 50 years of age. It's normally asymptomatic and very rarely can be the source of pain or hematuria or even hypertension. Commonly, if we find a cyst, it's seen on ultrasound, and there's some very specific criteria on ultrasound to determine if, in fact, this is a simple cyst. There should be no internal echoes. The margins or walls of the cyst are sharply defined, circular or oval. There is good through and through sound transmission on ultrasound. The density on a CT scan may be -10 to -20 Hounsfield units. We will often see these on CT scan as well, but usually ultrasound is enough to help us identify simple cysts. Now, if there's some confusion, certainly we can order a CT scan or an MRI. So when we see these, to reassure our patients that this is not a significant issue, we really need to have a comfort level in determining whether this is a simple cyst or a complex cyst. And we can rely on a Bosniak category of renal cysts to help us. And it basically talks about 5 categories of Bosniak type cysts. Category 1 is the simple cyst that I just discussed, with essentially a density of water and will not enhance on IV contrast if an MRI or a CT scan is offered. Bosniak type 2 is benign as well, with very thin, subtle septate walls with minimal calcification, if any. Then to screw us up in our thinking, they go not to 3, but they go to 2F as a Bosniak category 2F, which is essentially the third type of cyst. This is well marginated without significant contrast enhancement, but it does have some, and is greater than 3 centimeters in size. And then we get back to Bosniak level 3 and Bosniak level 4, which are cystic with masses and thickened walls that increase in severity. Do have some uptake. The Bosniak 3 will have about a 40 to 60% associated chance of malignancy, all the way up to 85 to 100% in a Bosniak type 5. So a lot of radiologists who identify cysts will assign a Bosniak category. Oftentimes, we will certainly obtain periodic ultrasounds for mostly patient comfort rather than a real need to diagnose anything if we're seeing a Bosniak 1 or 2. A lot of cysts are identified in clinics that work with kidney stones. So be prepared if you're following your patients with upper tract imaging for kidney stones. Often ultrasound findings of cysts will be encountered. So this is just one aspect of renal masses that we need to be comfortable with, and rely on your Bosniak categorization. Up to date websites have a great classification system. Certainly look at the AUA update and Campbell's Urology for any further discussion. Again, renal cysts with Dr. Bill from Just the Tip of Urology School.